Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Hello. We're going to talk today about what we call rehab-itis. That's not a medical term, but it's something we've kind of noticed over the years, and sort of phenomenon that we've seen with people who go in for rehabilitation and may need to have an extended period of rehab, 3, 4, 5 weeks. And at some point, they may become almost like they're not only not making progress, but they're losing progress in the rehabilitation unit.
As an example, someone who breaks a hip or has some sort of joint surgery like shoulder or knee, or if they break their hip and have to have surgery, they'll be in the hospital and they'll have some rehabilitation, physical therapy.
Maybe
and
just for 2 or 3 days.
Yeah, very brief period of time. And it's too soon for them to go home, and so they need extended rehab in addition, in an inpatient setting. So they'll go to a long-term rehab facility or a nursing home that provides rehabilitation on one of their units.
And the idea is not that they're going to be living in the nursing home, but that they might be there for 3 or 4 weeks for physical therapy twice a day and all the assistance and care that's needed.
And make more progress and meet the goals they need to meet in order to go back home. But what happens is, and I'm sure those of you who are listening have probably seen this in a family member, the person will stay there, and after a while,
2 weeks, maybe 3,
not making as much progress. The therapists are maybe starting even to refuse to go to all the therapy sessions.
May look more confused.
Yes.
Maybe sleeping more, much more apathetic, and kind of noticing that the call light isn't getting answered as soon as it used to be. But the big thing is that they might stop making progress in rehab. So if it's a broken hip, they would have them standing, and then the next day maybe they were taking a few steps. And now it's been 3 weeks and they're still only taking a few steps, and it seems like they're not being quite pushed in rehab. Well, what happens, we think, and from our observation, this is why we call it rehab-itis, is that lots of times with patients in rehab who are there for a while and become more familiar to the staff, you lose the momentum. And typically, as a patient, if I were a patient or you were a patient in a hospital for 3 or 4 weeks, patients in general tend to become more passive. That's just part of being a patient, because you're having things done to you and for you. You tend to be more passive. So in the rehab setting, that happens too. So the staff kind of lose momentum. The patient sort of becomes more apathetic and more passive.
It's a little harder to maintain that high level of motivation early on.
Because it's exciting to be out of the hospital, but then you have 6 weeks of this place stretching before you. And so there's sort of a dignity that can get stripped away. I've heard patients say that staff kind of stop answering the call light like they used to,
or at least not as quickly as they used to.
I had knew someone with an upper extremity surgery, and they would bring in the piece of ham for supper, but wouldn't cut it for this person anymore. So they were sitting there not able to eat, and then what we see is that the patient might become a little bit more confused. and like I said earlier, sleeping more often. So this is when it's really important for family members and care team and the care manager, somebody to be there and provide that momentum that the staff may have lost, and to be really an advocate.
And think of it this way, if you go into rehabilitation, you've gotten out of the hospital, that's such a relief, and you can kind of see the light at the end of the tunnel. But after a while, it's hard to maintain that motivation and hard to maintain that momentum. And so you start to lose that initial energy and that routine. It's a little easier to say, I'm too tired today to go to therapy, take a nap instead. Pretty soon you don't have that structure and people cheering you on.
And this is a particular problem in facilities that are also long-term care, where people might never go home. It's easy for the rehab patient to sort of become institutionalized, mm-hmm. and sort of fade into the background and be treated as if they have more cognitive impairment than they might mm-hmm. actually have, or be treated like the patients who have a lot of cognitive impairment, because that's just what the staff is used to doing. That's the way the day goes. Another thing that families need to be very careful about, though, is reviewing the medications as often as possible. Mm-hmm. It's not at all uncommon for unknown reasons for somebody to be putting up on a sleeping medication or extra pain medication that causes them to be cognitively more impaired or cognitively dull. And you think, oh, well, was there a little stroke, or do they have an infection, or is dad just kind of losing ground, when it may very well be something that's quickly fixable by changing medications.
And people will complain of more pain if they're not going to their therapy mm-hmm. as regularly. Things start to stiffen up and they get tired, and so they may complain of pain. And of course, the solution is some more pain medication. Mm-hmm. But then the concern is, oh, we're back, we're losing ground here, and so it's not looking like you're going to be able to go home as soon as we thought, which is yet another mm-hmm. Way that the person loses their motivation and momentum.
Right. So rehab, hospitals, families must be involved. You need to look at the medications. You need to look at what's happening in therapy. You need to talk to the therapist. If you can go during therapy sessions, you need to do that. And you might even need to cut that rehab short if you can do outpatient rehab at home, or there are other alternatives. There are a lot of good care managers who know about this whole system and can assist you in insurance payments and how all of that works. It can be pretty complicated, but you can't assume that things are going to go smoothly from one stage to the next. You really do have to be involved. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.